Hello, and welcome to the Virginia Commonwealth University Radiation Oncology Program Introduction. I'm Emma Fields, and I'm the program director here and have been since 2017. I've been here in Richmond since 2013 when I finished my residency at the University of Colorado and specialize in GI and GYN cancers. I also love education and I love working with residents, medical students, and fellows, and just today want to give you an overview of our program and some things that make it special. One of the most important questions you're probably thinking about is what happens after residency. I'll tell you that there's a lot of chatter about the job market, but we do prepare you well to get a great job, and our residents have landed great jobs both in private practice as well as academics across the country. Our current PGY5s have great opportunities as well, and they'll be happy to tell you about their experiences and the opportunities that have been available to them this year when you meet them at the interview. But here's an overview of the past, 7 years or so. And also these people are happy to talk to you about their experience in our program as well. Just to kind of look at the map and see the geography of where our residents end up. Some here in the Mid-Atlantic region, many down in Florida, where people wanted to go back where they were from, and several all the way out on the West Coast, both in academics and in private practice. And we really prepare you to hit the ground running when you get to your practice. This is posted with permission from Jenna Kahn. About 2 years ago, took a job at OHSU, and this is just an email saying that she had the best residency experience logs that they had ever seen. So that was pretty cool to hear. We also prepare you to pass your boards. We've had very high pass rates, and our residents feel very prepared and confident. And that's because of the protected time that's allowed for education, as well as the quality of those educational sessions. We have fantastic physics course. You'll be meeting with Dr. Tim Ritter, who teaches that program, and his energy and enthusiasm is absolutely unparalleled. We also have exposure to visiting professors, yearly mock oral exams, which often feature residents who've recently passed their exams. So you really are prepared with the newest material. You get access to RadOnc questions for 5 years. And then the thing that I love the most is hands-on educational experiences and workshops. And those are based on things that I think are most important for residents to learn. Now we'll talk about some of the strengths of our program. And I've got to say, brachytherapy has got to be one of the top strengths. For a small program, we have an incredibly comprehensive brachytherapy program. We do everything from the routine GYN cases to the complex, all kinds of breast implants with interstitial balloons, etc. Of course, prostate and other more rare things like HDR for rectal cancers, anal cancers, skin brachytherapy, etc. We have anesthesia support. We have a dedicated nurse, dosimetrist, and physicist, and fantastic setup now with 2 brachytherapy procedure suites and MRI access. Additionally, we have a very strong department commitment to both resident education and resident research. This is Dr. Weiss giving Dr. Rico the RSNA Röntgen Award for his dedication to research. Dr. Weiss is head of our resident research program and is very involved in that in the same way that I'm involved in the education program. But the faculty really respect that you're here in addition to work and learn in the clinic, that you're here to get exposure and experience with both education and research as well. To tell you more about some of our educational experiences, this is a picture from our IROC curriculum this past summer. This is the introductory curriculum that Rachel Jimenez and I initially developed. We do this every single year, and one of my favorite things is the day in simulation, where we get out all the immobilization devices and walk through cases. So even if you don't remember these things from orientation, you know at least who to come back and ask. And actually, all of the residents participate every year, so you gain a bit more understanding each time. This is one of our PGY2 residents this year, Joe Wilding. He got to try out making an aquaplast mask and is very pleased with his creation. But it really helps then when he hits the ground and goes into clinic, he can describe the process very well to his patients, despite being a very fresh resident at that time. And here is one of our visiting students trying out the prone breastboard. He actually looks pretty comfy, as opposed to Ross Taylor, one of our PGY3s, trying out the abdominal compression. He's giving us 2 thumbs down for that. But it's good to know, right? Because we ask patients to do things that are relatively uncomfortable. And it's good if you can kind of understand that experience for yourself. Similarly, this is Amanda Stark, one of our other PGY2s, getting her, I don't know, maybe first tattoo, but she's getting her first radiation tattoo for sure, so that in the clinic she can show her patients what the small dots on the skin are, and she can describe the experience. Each year we also do a contrast toast. Very often our patients are asked to drink large quantities of contrast material for their routine radiology scans, and often in our department as well. So we have everyone just try it so you can explain what we're doing. Some of the other workshops that we do are an image verification workshop. So actually play around with the offline review system and see the experience of checking the patient setup. We all spend a lot of time crafting our contours and fixing our treatment plans, but residents are often quite removed from the process of seeing exactly what happens on a day-to-day basis. So this kind of just brings it forward into your resident education, makes you aware of some of the things that happen behind the scenes. And this is the residents in action. This is actually pre-COVID. I didn't get a shot from this past year. You can see they're all in quite close. But this includes physics residents and medical residents working together to try and co-register images that are used for treatment alignment. We always do a brachytherapy annual hands-on workshop. This is an example of the GYN workshop. The idea for these is that they're sort of in a high fidelity situation. So we do these in our brachytherapy suite. We spend time putting together the applicators, placing them in models. We get to image them as well and then work on some of the treatment planning. And all of this is done in a low stress situation when there's not a patient under anesthesia. And it's really an opportunity to both teach and to learn and to ask all those questions that you can't under a time pressured situation. Another strength of our program, and I hope that you can feel this even though we're virtual, is that we have a really collegial resident and faculty group. This is a picture outside of the Egyptian building when there was a gathering of faculty and staff, and we had a huge representation from our department. We've also done some Astro happy hours despite traveling for neither of the last Astro meetings. This was us at a winery in 2020. And actually, we went back to the same place, just sat in a different area for 2021. And you can see how our group has grown with the addition of our new residents and 2 brand new babies as well. This is one of the pictures from our Marie Curie celebration. This was last year, and it was on a weekend, so there's just a few of us, but it's nice to include the kiddos as well, for sure. And here we are in Miami at ABS. actually connecting with some former residents at this point. Um, let's see. Uh, Two of these residents had already graduated, and then there was a VCU medical student who was in residency there that we connected with as well. So basically, once you're affiliated with our program, you become part of our family, and we try and connect as much as we can. Another strength of our program is that we are just in the transition now, and by the time we talk to most of you, we will be in our new cancer center, where we're getting lots of cool new technology as well. This is a picture of our new center. We have the second and third floors here. And this is the adult outpatient pavilion. So there's lots of other cancer associated clinics here as well. Infusion is here, Gynonc, ENT, etc. Our clinic in here is on the second floor, where we have two brand new TrueBeam linear accelerators. We also have the Meridian MRI Linac and an MRI simulator, as well as a PET CT sim. And this is also where we have our two brachytherapy suites, both with anesthesia support. And they're actually right next door to this MRI simulator. So lots of exciting new technology, lots of opportunities for resident research and collaboration with our physicists. Another strength of our program is the VA experience. We have an excellent VA hospital, the Hunter Holmes McGuire Hospital, here also in Richmond, where we have Dr. Michael Chang as the chief, Dr. Matthew Schutzer as the residency site director, and those are both VCU grads. We also have Dr. George Chow from UPenn and Dr. Sarah Hazel from Hopkins. So we have a really great faculty there, very invested in resident education, and you spend about three-month rotations there. We also have a great LDR prostate program there. And of course, you just kind of see a different population as well. And adding to that, we have a community practice experience as well. Dr. Urdaneta, who's here downtown treating most of the prostate patients, also has a breast practice at Hanover Memorial Regional Hospital. He goes there 1 day a week, and so when you're on his service, you go there as well, and you kind of get to see how it works, networking with other providers in that sort of a setting, which is really exciting because many residents don't get that experience, and therefore it's more challenging to decide how to choose the right fit when you're looking for your own opportunities for work. We have a really diverse patient population at VCU, which I think is one of the best parts of this job. We cater to a huge uh, region in Virginia. We have a very large catchment area. This is a map of Virginia, and our catchment area is all the shaded in yellow. So it's the whole eastern and central portions of Virginia, and in fact includes 55 of 66 counties. Um, and many of these are classified as medically underserved. These counties have some of the highest rates of obesity, smoking, diabetes, and food insecurity in the state. And in fact, between counties in Virginia, there's a 25-year life expectancy gap. And Petersburg is a city just south of us, which has one of the lowest life expectancies. So given all of these risks, we do see a high cancer burden, and we do see complex and advanced cases. But thankfully at VCU, at Massey Cancer Center, we have fantastic social workers, we have supportive care clinics, we have nutritional support, clinical trials, and resources with outreach, where I think we're really making a difference for these people. So if you have an interest in caring for the underserved, this is certainly an excellent place to be. Another reason to be here is that Richmond is a great place to live. Honestly, I just love it, and I know the residents want to tell you a lot more about that as well. But just to show you a couple of pictures, these are actually from one of my running friends. This is a gorgeous view of Richmond at sunset. We have lots of green space within the city. We have the James River that runs right through the city, and lots of trails and parks around that, as well as the urban amenities that you could expect from a medium-sized city. This is one of the green spaces within the city. This is Maymont Park, and it's just gorgeous. There's Japanese gardens, there's an animal farm, lots of walking trails, things to do. Residents in our program have 42 months of clinical rotations divided into 3-month blocks, and that includes an optional 1-month away rotation at St. Jude. I say that's optional because we actually get plenty of pediatric experience here, but some of our residents, and in fact, most of our residents really like that experience to go and work in a different setting and also get proton experience. We provide housing while you're there, and I think it's a really nice setup. We also offer 6 months of research that's under Dr. Weiss. And again, you can do that in the lab, you can do that with physics or clinical research or all of the above. And there's certainly the potential for extended time, and some of our recent residents have extended that research time. There's no cross coverage when you're on service. So there's definitely extra time there to do research. There's opportunities to teach and also to get involved in the med school as well as our radiation oncology interest group. Our residents are really active in going to meetings. Here's some of our residents at both ASTRO and ABS giving poster and oral presentations, and there is a lot of support for that. Even in the virtual world, here is Bridget Quinn, one of our chief residents presenting at ABS this year. She had an oral presentation and did fantastically. There's also the opportunity for international travel. This is Sherry Zhao, who graduated a couple of years ago, who went to a remote part of China where she learned what they do and was able to teach them some of the things that we do specifically for cervix cancer. And I know she had a really interesting experience, and we certainly support that kind of experience moving forward as well. This is a picture from this past spring. Our group was part of the Massey Challenge. We have a 10K every spring, the Monument Avenue 10K. And the BEAM team was the top fundraising group, and we just had a blast. We sure hope that you will come and join us. Please contact Joe Lombardi for any further questions or information, and I look forward to meeting you all and hearing all about you as well. Thank you.